I have a question for you.
Yeah.
Okay, so I was just talking to somebody about intuitively, I can tell that breath work, this kind is fine, but there are some that can, if it's not done correctly, kind of go the opposite way. Is that true? Or
What do you mean?
I've seen, I'm really not educated.
Breath work that can induce anxiety?
And then
Absolutely.
oh, so there's a lot of practitioners that will practice and say it's a way of clearing that. Is that true?
Of clearing what?
They'll induce an emotive state and then re-regulate, kind of like EMDR, but with that.
Right.
That's
Right. So there's a lot of different ways to breathe. And so when you're doing breathing techniques, you need to ask your practitioner why you're doing that breathing technique, because there are a lot of different breathing techniques that stimulate different areas of the brain and body. So when I work with MS patients, I do amygdala breathing. Amygdala breathing is a form of breathing that goes in through the nose and out through the mouth, but it actually vibrates the roof of the mouth, which shakes the amygdala, which helps them focus cognitively and helps them calm down. Okay. But then there's stacked breathing, which stacked breathing actually helps with your pulmonary capacity. So if you have COPD, then you're going to want to maximize your pulmonary capacity. If your breathing practitioner cannot give you the mechanisms for what their breathing technique can do to the body, then maybe that breathing technique is questionable. There are also breathing techniques that are going to actually increase your carbon dioxide level, which is going to increase your anxiety level. So you want to know what breathing technique you're doing and why you're doing that breathing technique. Because I'm not saying that there aren't good breathing techniques, but I'm saying that you should never just do a breathing technique because someone says do a breathing technique. So when I was talking about the vagal nerve breathing technique that I do, I told you what technique I'm doing, what it does in the body, why we're doing it, and how to do it. So if you're learning a breathing technique, your practitioner should be able to give you all of that information. Because if they can't, then why are you really doing that breathing technique? Because I know a lot of breathing techniques, pursed lip breathing. So, I mean, when we have a COPD patient, we do one kind of breathing technique. Like I said, when we have an MS patient, we do another type of breathing technique. It just depends on what type of patient you have and what your goal is and what kind of breathing technique to do. So you should always ask those questions instead of just say, oh, this breathing technique works for this, or this breathing technique works for that. Just ask, why does it work? If they can't answer the why, then find out together. Like, you don't have to say, oh, well, if you don't know the why, you don't know what you're talking about. Maybe you could say, well, let's find out together. And maybe someone asks you the why and you're like, I don't know why it works. I just do it because it works. But maybe you can find out the why together. So, I mean, don't be like really quick to put someone down, but maybe be really quick to find out the why together instead of saying, oh, I don't know, because no one person knows everything, but there are different reasons for different breeds.